Hello, my name is Dr. Stephen Faber, and I'm a board-certified gastroenterologist and fellow of the American College of Gastroenterology. And I've been in solo practice in gastroenterology now for about 17 or 18 years. And originally from the New York City area where I trained at Lenox Hill Hospital, where I spent most of my life in the New York area. And the reason that I have wanted to make this video for quite some time now is because I've treated thousands of patients, individuals who have suffered from irritable bowel syndrome for years, and have accumulated a lot of information and knowledge that I want to share with you. I feel that we can do a lot more for the typical IBS patient today than frequently may be offered in most cases. My hope is to make this presentation as informal yet professional but informative, and as you see, I'm using my notes here to sort of guide me in this presentation, because I don't want to, I want it to be so informal that I may even decide to look at my notes a little bit and focus on some things that I want to phrase differently. It may be a good idea to take some notes of your own so that you can bring these things to your doctor's attention if you want to do that. This information is not a substitute for a physician's care and evaluation, and should not be used to self-diagnose. And that's very important. I sort of wanted to design this presentation in a way that I was in my office, as I am now, in a patient room where I'm chatting with one of my usual patients who have IBS, but imparting in that visit to them a tremendous amount of information about IBS and how some of these things can again improve someone's quality of life who suffers from this problem. So I'm attempting to reach people who have been diagnosed with IBS. I'm attempting to reach people who may be suffering with symptoms of irritable bowel syndrome, but who maybe have not made a diagnosis yet. And again, that diagnosis has to be made by your doctor. This video may actually, in some ways, help the care of an IBS patient by the medical profession and other extended caregivers, because it's going to touch on a lot of specifics and nuances of irritable bowel syndrome. So you're someone with IBS and your doctor has just told you that your colonoscopy was unremarkable, a couple of polyps, and you're wondering right after you wake up, okay, but why does my belly hurt? Is the typical question we get asked. And the doctor may or may not say, okay, well, your tests are negative, we don't see anything. You may have a little irritable bowel, and here's some Metamucil. And that's unfortunately a very frequent scenario. Unfortunately, for most patients with irritable bowel syndrome, that may not be the best way to treat the majority of their symptoms. Many studies have been written about IBS, and we're dealing, when you're looking at IBS now, I think they've quoted that this is a $30 billion a year cost to our society because of the number of tests that are done to help make the diagnosis, frequently possibly unnecessary and repeated tests, the people who can't work because of their irritable bowel syndrome, loss of days at work, and of course the cost to the medical profession. 2 to 3 million patient visits a day occur every year for irritable bowel syndrome. I have found that some of the most difficult issues one has to deal with when diagnosed with IBS is the acceptance of the diagnosis. Because true belief and understanding of what IBS is and how it can be controlled and treated, although not curable, is important to be able to move on with treatment. And the diagnosis of IBS is in the history. Most of the time I help my patient get to that level of acceptance by going back with them in time to when their first symptoms started. And this usually, and the patient and I will usually find the significant event in their lives that right after that event, they began to notice either a change in their bowel habits, abdominal discomfort, gas and bloating, and the other classical IBS symptoms, which we'll talk more about. This helps the individual make a mental correlation of the onset of symptoms to an event that may have been the trigger or the initiator of the IBS. And a disease state doesn't have an emotional or social trigger. And that's automatically sort of helps separate a functional abnormality like irritable bowel syndrome from a true disease process, such as colitis, Crohn's disease,